talk all about Group B strep. This is one of those areas in maternity care which gets loads of media attention, and often because the effects of Group B strep can be devastating for the parents who are affected by babies who become severely unwell with Group B strep. But what are the risks, and should you be screened during your pregnancy? So let's start with what Group B strep is. So Group B strep is a naturally occurring bacteria that between 20 and 40% of all women and pregnant people carry. This is around about 150 to 200,000 women and people a year having babies. But the rates do vary between ethnicities and countries. There's often no harm to women who have Group B strep, and it can be present one day, gone the next. This is what makes screening so challenging in itself. Very occasionally, if a woman or person has Group B strep within their urine, it can cause urinary tract infections, so UTI symptoms. This often requires treatment with oral antibiotics during the pregnancy. UTIs can also trigger preterm labour and birth, just to be aware of. The very first urine sample that you provide to your midwives at the booking is sent off to the labs. It can be tested for a variety of bacteria, and sometimes this includes Group B strep, which is why some women do detect they have Group B strep earlier on without even thinking about screening for it. One of the biggest problems with Group B strep is that it can affect some babies quite severely, causing sepsis, long-term health problems, and even sadly death in the rarest circumstances. And the problem is knowing which ones are going to be most affected and which ones aren't. For statistical purpose, Group B strep affects around about 1 in 1,750 babies in the UK. On average, this is around 43 babies developing early onset Group B strep every single month here in the UK. In total, this equates to about 516 babies in total a year. It can be fatal in around about 1 in 35,000 babies, so around about 2 per month here in the UK based on our birth statistics and figures. Just for context, there are other conditions during pregnancy, labour and birth that have much higher rates, highlighting how rare the chance of death is from Group B strep. The UK has chosen not to screen all women and people for several reasons. Partly because of the low prevalence. 1 in 35,000 chance of death, sadly, is an incredibly low and rare chance of happening. And a chance of 1 in 1,750 babies developing early onset Group B strep is still very low in contrast to lots of other things here in the UK. But also because it would mean more women and people, and therefore babies, would have antibiotics unnecessarily, purely because of the transient nature of Group B strep. It can be there one day and not the next. You could be testing positive and then it's disappeared, and this has problems with things like the gut microbiome, increased allergies as well in the future. And sadly, that screening could have happened earlier in your pregnancy and then suddenly you're negative at the point of birth, or vice versa. You could have been negative earlier on but suddenly positive, and we don't know about that. There is ongoing trials about point of care testing where you have a swab at the time of birth, and this will detect it more accurately in the future. When that point of care testing does come in, it will mean that those who have Group B strep at the time of labour and birth will be appropriately offered antibiotics to reduce the chance of that Group B strep transmission to babies, helping to reduce the early onset Group B strep. However, until that test is accurate and comes in, it's very difficult at this stage. Perspective, one study found 10% of all women with negative screening were positive at the time of birth, and 50% of women who screened positive were negative at the time of birth. This is all in this wonderful book by Sarah Whitten. It goes far more into the detail and the research and the evidence in a really easy to read book than I could ever put into a video, so please go and check it out. Now, because here in the UK we do not routinely test or screen women and people for Group B strep, there are some people who will be offered intravenous antibiotics during labour and birth in women and people who have other risk factors. And this is because certain factors within your pregnancy, labour or birth can increase the chance of developing early onset Group B strep with or without a positive or negative swab in the pregnancy period. The reasons for offering antibiotics during labour into your veins include any labour or birth that happens before 37 completed weeks. The women and people who are in that labour period will be offered intravenous antibiotics to lower that chance, because if babies develop Group B strep and are born before 37 weeks, they are more likely to develop early onset Group B strep and be unwell from it. In addition, if there are any signs of infection during that labour or birth, so a rising baseline on the heart rate trace, for example, if there's an increasing baseline that you can hear on auscultation, smelly, offensive waters and liquor, for example, or if you have a temperature of more than 38 degrees. All of these risk factors increase the chance of developing early onset Group B strep. And these women and people will be offered intravenous antibiotics to lower that chance. In addition, women and people who have had a previous baby who had Group B strep or Group B strep infection, they are more likely to have Group B strep again in future pregnancies. Whilst the research in this area is incredibly small, there is more research needed to confirm why this risk factor exists. All babies have a risk assessment when the birth has happened, and what will happen is that midwife will look at all the factors, including whether there's been any group B strep, for example, whether there's been any signs or symptoms of infection, the gestation, and these babies will be recommended whether they have or have not had antibiotics to have some observations in that postnatal period. This is often every 2 hours for at least 12 hours. In most units, it then transfers over to 4-hourly for up to 24 hours, depending on the number of risk factors there are for your baby developing infection. This immediate assessment after birth will also include any babies who are at high risk of developing that infection, and they may be recommended to have intravenous antibiotics themselves, which may mean that you stay in for at least 3 to 7 days. Another challenge is that benzoyl penicillin is the one that's been most heavily researched, but it is a penicillin-based medication, and so women and people who have a penicillin allergy, particularly if it's severe, should have an alternative called vancomycin. In relation to vancomycin, there have been no clinical randomised trials to assess how effective these antibiotics are in preventing and reducing the chance of group B strep. From the correlational research, benzoyl penicillin has been the one that's most effective at reducing the chance of the development of early onset group B strep. Whether women and people do or do not have the antibiotics in labour, it will be recommended anyone who's had a positive group B strep screen will be having observations for their baby after birth. It's also important to acknowledge that having intravenous antibiotics may also limit your birthplace and options as well, because the intravenous antibiotics will need to be given in either a delivery suite environment or potentially in an alongside birth centre. Whilst water births are more than possible, a home birth would not necessarily be possible because of the intravenous access needed, the intravenous medication, the risk of anaphylaxis, the allergic reaction to any sort of antibiotic, but also the need for the prescription as well. In relation to the risk of developing infection, the infection risk is primarily after birth, so there's no need to have continuous monitoring as long as there are no other risk factors, no other signs and symptoms of developing sepsis or infection. So there's no real difference during the birth other than the intravenous antibiotics, unless there are other things going on for you and your baby. Now, lots of people ask me whether or not there's any way to reduce the chance of developing early onset group B strep. There are some ongoing studies looking into vaginal douching during labour or before vaginal examinations and the group B strep prevalence in the UK at the moment, but we're awaiting the outcomes of these trials and studies. Minimising internal examinations during labour has been shown to reduce the chance of infection to women and people and babies overall. But these are often recommended every 4 hours in labour, but it is something to discuss with your midwives, particularly if your waters have already gone, whether they can be delayed in any way, shape or form. Breast milk is also being studied at the moment as well, because there have been sugars found in breast milk which may protect newborns against group B strep bacteria in the early research trials too. Highlighting the wonderful benefits of breast milk still. So should you get a private swab or not? Well, that's entirely up to you with what you would like to do. I highly recommend that you read Sarah Wickham's Group B Strep book for further information. You have a look on the Group B Strep support website. The RCOG have got all of the information you need as well, both patient information leaflet, but also for healthcare professionals. Your brains, benefits, risks, alternative, instinct, and nothing to decide what is right for you. There's no right answer with paying privately for the screening test or not, to have antibiotics in labour or not. It's your choice, your pregnancy, your birth, your baby, based on your medical history, both past, current and previous. If you're not already following or signed up to Sarah Wickham, please go and check her out. Go and get the book. She's a fantastic midwife and researcher.